Radiology is blind spot and hospital infection spread. Healthcare-associated infections, formerly known as hospital infections, are defined as infections acquired in any healthcare setting, such as an inpatient, outpatient, radiology department, or emergency room. In recent years, there has been a serious increase in these infections and has risen to the fourth place among the diseases in developed countries and has entered the agenda of the World Health Organization. In developing countries, these infections are 20 times more common than in developed countries. Center for Disease Control estimates that the total annual cost of healthcare-associated infections in North America is $6 billion versus €2.4 billion in Germany. Previously, healthcare-associated infections were thought to be limited to hospitalized patients, but many infections can also be transmitted during outpatient visits. While 55% of healthcare-associated infections are transmitted by colonized or infected healthcare workers and hand contact, 28% of these infections are through direct body contact. Other transmission routes are during contact with contaminated surfaces, transporting the infected patient within the hospital, or removing personal protective equipment. The cost of delaying patient admission for cleaning in radiology or closing it due to infection is very high for hospitals. Effective surface and air cleaning system like Innovis V222 may provide uninterrupted service for radiology departments. In the presence of poor infection control practices, antibiotic-resistant bacteria are often transferred from patients to the radiography machine, and these can be a source of cross-infection/colonization. Computed tomography and magnetic resonance imaging devices in radiology departments are potential sources of pathogenic bacteria. Bacterial contamination is common in ultrasound probes, cables, and keyboards. In the so-called hybrid rooms, procedures that include a combination of partly radiological intervention and partly open surgery are performed, and the prostheses used can be easily infected and effective protection is needed. Especially during the COVID-19 period, patients and their attendants stayed in the radiology waiting areas for a long time, and insufficient ventilation brought an inevitable possibility of infection. Colonized and infected patients may increase the likelihood of hospital-acquired infection in radiology waiting areas. Up to one-third of hospital infections can be prevented by appropriate methods, such as cleaning medical equipment. In a Carling study, 88% of radiologists stated that the main cause of contamination of radiology equipment was the lack of proper disinfection on a regular basis. Innovis V222 system may provide necessary air and surface disinfection in all areas of radiology departments and become industry standard in the future.